Meantime, a nursing home near Ottawa is seeing a drastic spike in deaths from COVID-19. 10 residents at Almount Country have died since March 29th, and additional 20 residents have tested positive. That means nearly half of the home's residents have contracted the virus. Some staff members have also tested positive, but the home is not releasing those numbers. Donna Duncan joins me now. She's the CEO of the Ontario Long-Term Care Association. Good morning to you, Donna. So glad you could be with us. So we're seeing this virus break out at more nursing homes across the country. They really become the epicenter of this pandemic. How concerning is the trajectory of this virus? Once it gets inside a nursing home, can it be contained?
Well, Marcia, this is a tragic situation when we look at who our residents are. They really are the most frail and vulnerable. And our priority has been, as somebody, I think, one of my colleagues in BC said, our job is to fight against the outside. So keep the outside from coming in. But once it's in, how do we mitigate it? And, we've been really lucky in Ontario. We don't work in a vacuum. We've been fortunate insofar as we've been learning from the lessons from BC and from Quebec. And our government's given us measures on an ongoing basis. As we see issues, they're responding. So the most recent directive that came down yesterday was universal testing for all residents and all staff in long-term care. In addition, universal masking for all residents and staff and all visitors in long-term care. The government is committed to making sure that we have the supplies. They prioritize long-term care homes for those supplies, for those tests. They're deploying teams to help us do those tests, and they are ramping up the testing as well in terms of the turnaround time for tests so that we will know what the counts are, we'll know how to manage them. We're taking measures around cohorting and isolation. Anyone coming from hospital into long-term care now has to be isolated for 14 days. So it's tough. Once it comes in, it is really difficult, but our staff team members are professionals and they are doing whatever it takes.
So what happens if if a resident does test positive? Are they removed from the home?
They're isolated. So where possible and whatever measures we can use in the home, they are isolated, they are cared for, they are given supports to treat their symptoms. But the staff and residents are masked, will be masked as well.
What are you hearing from residents and their family members who are concerned about their well-being? And I will include their mental health in that question, because it is a very lonely time for these seniors.
Mm-hmm. That's a great point. There is a lot of fear. And we're trying to quell that fear. As I've said on many occasions to those with whom I've been speaking, our staff are professionals. The most important thing that we can do is keep the outside from coming in, keep the COVID-19 from coming into our homes. Virtual visits, are key and important. Certainly, we're working to staff up our homes right now as well. We had a critical staffing shortage before it arrived. And so we are working to bring in new health aides to help with activities, to read to residents, help them with their virtual visits, help them with other activities, as well as take the pressure off our nurses and our RPNs and our PSWs so that they can really focus on those who need the highest level of care during this.
Donna Duncan. Donna is the CEO of the Ontario Long-Term Care Association. Donna, thank you very much. Appreciate your time with us this morning.